Welcome everybody to our second annual joint presentation, Meaningful Ageing Australia and Anchor Excellence. And of course, we know that we do this in Palliative Care Week, and we do it as a tribute to all those fine people that work in palliative care across Australia. And we are so proud to be associated with them. Today, we're going to be looking at how we care for older people as they transition through different levels of care. And of course, this is totally in line with the strengthened aged care quality standards. Next slide, thanks. However, before we start, we'll do an acknowledgement of country. And in the spirit of reconciliation, Meaningful Ageing Australia and the Anchor Excellence team acknowledges the traditional custodians of country throughout Australia and their connections to land, to sea and to community. We pay our respects to elders past, present and emerging, and today we extend that respect to all Aboriginal and Torres Strait Islander people that might be with us today. We've got some high-level objectives for this session, and I hope that you're going to find it really, really enjoying. We're going to look at your role in transitioning care levels in aged care in the context of the strengthened aged care standards. We're going to look at what spiritual care means in the care transitioning context. We're going to take a walk through the importance of individual assessments in spiritual care planning. And we've got a case study about the lived experience of Michael and Sula as they transition from home care to residential care. And we're going to put that into the context of the strengthened aged care quality standards. And then we're going to talk about how Meaningful Ageing Australia and Anchor Excellence can support providers to embrace spiritual care and to embed it into their everyday practice, policies and processes. As I just mentioned, it is National Palliative Care Week, and the theme this year is Matters of Life and Death. It runs 19 to the 24th of May, and it's Australia's largest annual awareness-raising initiative to increase understanding of the extremely valuable contribution palliative care can make to the lives of people with a life-limiting illness and, of course, to their families and friends. Meaningful Ageing Australia and Anchor Excellence are absolutely delighted to present this webinar as our contribution to National Palliative Care Week 2024. As I said earlier, this webinar is truly dedicated to all people that make an outstanding contribution to high-quality palliative care provision and for the people that receive this care. Just a quick overview for you of the strengthened aged care quality standards. Some of you will be familiar and some of you won't be familiar with this. We've got a new wheel with different colours for the different standards. And standard 1 is the person, and it's the most powerful statement in the whole of the literature around the standards. And it says, I am valued and have choice over the life I lead. That is a very powerful impact statement on care and service delivery in very many domains. The second standard is the organisation, and you may recognise this as the current standard 8, but it has got some new additions to it, and that is about how the organisation provides a safe and quality care and service provision environment for older people. Care and services, which is standard 3, is about how people are assessed and how the planning evolves from those assessments. Standard 4 is the environment, and this is a new addition to the standards. On the surface, it appears to be a very short standard. It's only got 2 actions. However, they're very powerful actions. Standard 5 is a very complex standard, and it builds very heavily on standards 1, 2, 3 and 4, because it's how you actually deliver the care and services to older people in any Commonwealth-funded aged care setting, and that clinical care is based on the assessments from Standard 3, the care and services. Standard 6. I should add here that people from home care, you're off the hook after standard 5. Only standards 1 to 5 actually apply to the home care environment, but standards 1 to 7 apply to the residential aged care setting. So 6 is all about food and nutrition for those people in residential aged care, and standard 7 is the residential community. And we hope as we walk you through Peter and Sula's story today that you'll begin to understand the connect between home care and residential care and the spiritual implications of that. So let's have a look at Michael and Sula. This is the journey of Michael and Sula. Sula's 85 years old. Her husband, Michael, is 89 years old. They migrated to Australia from Greece 40 years ago and settled in the inner west of Sydney. This was a typical area where both Greek and Italian migrants lived on arrival to Australia. Michael and Sula raised 4 children. 2 sons still live close by them, and their 2 daughters married and moved overseas. They have FaceTime contact every few days with their overseas family, and both Michael and Sula value their faith and are regulars at their local Greek Orthodox church. They currently live in a retirement village in the same area, and they both receive a level 2 aged care package for support for their needs, goals and preferences. Their son David, who lives nearby, is their substitute decision maker, and in the brave new world of the strengthened standards, you will find that that term is diminishing and the term nominee is coming into play. So their son David is their nominee, as they both have declining cognition. Michael expresses his concerns about how long they can stay living in their retirement living situation, as they've both had falls and have mixed up their medications. The medication mistakes led to Sula accidentally overdosing on her digoxin and had to be hospitalised as a result. They both enjoy walking around the village and the local shops. Michael self-reported to their home care provider that they get lost at times and find it hard to get back home. On their last walk, Sula wandered away from Michael while he was ordering a coffee for them both. Sula was unable, once she'd wandered off, to use the traffic light system at a major intersection and unfortunately was hit by a car. This resulted in multiple injuries, a fractured femur, elbow, and she had significant abrasions and bruising to her body. This meant surgery and a lengthy hospital stay for her. Initially, Michael was reluctant to consider any form of residential aged care, including a respite stay. His son David did encourage him to reconsider. Whilst Sula was in hospital, Michael sustained a minor fall getting off the bus on his way to see her. This really shook his confidence badly and led him to reconsider his residential living options. With David's help, they found a Greek faith-based residential aged care home that had a double room and a small sitting room. Michael agreed to this move as Sula's care needs were more than he could manage at home, even with a package. He also recognised he was not getting younger and had his own medical issues to deal with. So if we go back to our wheel, the strengthened standards wheel, just from that very brief high-level story about this couple, you can see how important it is that they're valued and have choice over the lives they lead. We often see people making choices about transitioning between levels of care at a point of crisis, and I think that they did realise that this was a point of crisis. We look at the organisational implications as people think about moving between levels, the care and service assessments that have to be done, the suitability of the environment, the complexity of the clinical care that's going to be needed, the type of nutrition and hydration they will both need in order to maintain their well-being, and what is the residential community really going to be like and mean to them. If you're not familiar with this wheel, you will become very familiar with it in the next little space of time. So we move on to look at what your role in palliative care in aged care is really about. Now, we do talk a lot about the physical aspects of ageing and the need for palliative care. And I guess for many people, if you say palliative care, they go immediately to think about, well, what are we going to do to help this person be comfortable physically? And quite often the spirituality of their needs is lost. So the journey to palliative care is far more than meeting physical needs. However, meeting physical needs will always be an important part of palliative care. Some of the physical care aspects of palliative care for Sula, that should be Sula and Peter, include personal care, pain management, wound care and management, skin care, continence care, respiratory management, nutrition and hydration, importantly, medication management and mobility support. So your role in palliative care, whilst meeting these physical needs, goes much, much further. Confidence in having dialogue about spiritual care planning during palliation is extremely important. I'm going to hand over to Rachel now, and she's going to start talking about spiritual care and the broader meaning of spirituality.
Thank you so much, Dr. Irene, and thanks to Anchor Excellence in partnering with Meaningful Aging Australia. My name is Rachel Wass, and I am the CEO of Meaningful Aging Australia, and we're the peak body for spiritual care and older people. So let's come through to this slide: spiritual care and spirituality. In recent years, we've seen a lot more research around the ways in which spirituality can support health in the context of healthcare, nursing, ethics, social work, in psychology, and particularly in the realm of palliative care. And the research demonstrates that a focus on spirituality improves patients' health outcomes, including quality of life, right through to end of life. And conversely, negative spiritual and religious beliefs can cause distress. So this can also increase the burdens of illness. So it's important for us to get a handle on this topic. And I do want everyone to know, just to reassure, that spirituality for some can be an uncomfortable concept or something that might appear confusing at first. But what Irene and I want to do in this session is to try and make that a practical sense and something that is more easily understood. So let's think about ourselves for a minute so we can really grasp the concept of the broader sense of spirituality. And if you look on the slide there, we've got a definition that's offered by Pulcheski. Our need for meaning, purpose, and connectedness with ourselves, with others, creativity, nature, and for many, something beyond ourselves, are all part of our spirituality. So that's a pretty wide definition. And I often think sometimes that's great to just kind of sit with that definition and those different domains and think about for yourself what aspects there that's mentioned in that quote that really resonate with you. What of those aspects there make you feel more at peace within yourself? Because that's what we're trying to aim for when we're taking care of Michael and Sula in this case, and their individual needs. Because as human beings, we are intrinsically spiritual. Every person is in some way in relationship with themselves, with others, nature, the significant or the sacred. A question that we often get is, can a person be spiritual without being religious? Well, yeah, you can. Spirituality can be independent of religious or other beliefs. However, it can also be an extension and part of one's religious faith. And we know, as we'll sort of look a little bit more, that Michael and Sula certainly have faith as a part of their resilience and things that are important to them. So they're not mutually exclusive now of that, though. So if we think about that definition of Puchesky's, something beyond ourselves, there could be nuances between both Sula and Michael that we might not be addressing in their spiritual needs overall. I also want to add here that in the terms of Aboriginal and Torres Strait Islander peoples, spiritual care includes the whole person, their social, cultural, emotional, and spiritual well-being. So it's just understanding that each person is quite individual in the sense of how they express their spirituality. As a facilitator of spiritual care, your role includes the individual spiritual care assessments for each older person, and that these assessments reflect the individuality, as we said, of each of those. Michael and Sula may actually have differences as well as common needs. So that can be informed in the care and services plan. And this is really inbuilt into the Strength and Aged Care Quality Standards. As Irene has gone through, that's really very focused on person-centered care, and that personalized sense of the journey embraces both Sula and Michael's physical, social, and spiritual needs, goals, and preferences. We've got 2 reference documents here that can also be very helpful to inform you in how to undertake that and reinforce the aspects, particularly in relation to palliative care. The National Palliative Care Standards for all health professionals and aged care services, the 5th edition, is there on the left. And it states that spirituality is a fundamental element of human experience. Spiritual care is an essential domain of palliative care, which focuses on the needs of the whole person and their family. And that's also another important element that we want to consider with spiritual care. Comprehensive assessment of needs, initial and ongoing assessment, incorporates that person's physical, psychological, cultural, social, and spiritual experiences. And then in the national guidelines for spiritual care and aged care, it really notes that spirituality encompasses the individual's search for meaning and purpose in life and experience of the transcendent. And that really does come into play when we talk about palliative care in particular. It's certainly associated with support during times of crisis, ill health, loss, grief, and palliative care has much to offer in these areas. So underpinning both these guidelines is the philosophy that the spiritual dimension is intrinsically human, and assessment needs to be recognised, respected, so that they have access to care in a way that's really meaningful for them. I really want to share this wonderful diagram as well, because many of you watching today may actually be working in aged care or certainly healthcare or social support. And spiritual care is also really good for healthcare practitioners too. This is a summary depicting an international consensus about spirituality and healthcare, and in its relationship to compassion and the benefit of that, the outcomes that can be for those of us working in the care professions. So you can see that in this model, there's 2 wings on the outer edges. One is spirituality and the other is compassion. And then there are viewpoints of common dimensions, intervening activities, and then the resulting patient outcomes and healthcare professional outcomes. Spiritual care is grounded in important theoretical frameworks, and one of those is one you may have heard of, which is the biopsychosocial spiritual model of care. And the other is patient-centered care model, in which the focus of care is on the older person and their experience of illness, as opposed to the sole focus of the disease. And so there it is again, just weaving that back to the new revised standards of patient-centered care. Integral to both models is the recognition that there's more to the care of the older person than the physical. But this is where the interesting research and consensus of international experts that this diagram is trying to attempts to summarize is that a clinician's capacity to be compassionate is actually connected to his or her own inner spirituality or vocation. So it's really important for us to care for the carer, to understand of, your own senses about spirituality and sources of resilience and well-being, your emotional well-being. Compassion is an attitude, a way of approaching the needs of others and of helping others in their suffering. But more importantly, compassion is a spiritual practice, if you like, a way of being, a way of service to others, and an act of love in essence. So spirituality is intrinsically linked to compassion, and healthcare practitioners, by being aware of their own spirituality, including a sense of transcendence, meaning and purpose, are called to service, connectedness to others, and transformation, are more able to be compassionate with the people that they care for. So I just think this is an interesting one to think about, that particularly as we have so much reform and, I guess, stresses that impact onto us as care deliverers. So what would a spiritual plan actually look like and contain for Sula and Michael? So there are things that we already know. They, as Dr. Irene mentioned, they have a Greek Orthodox domination and are very active members of their church. They celebrate specific holy days on the calendar. They do have icons in their home, and they are certainly supported in their spirituality by close family. But what we probably want to understand a little bit more as well about this is that particularly within Greek culture, the Greek culture emphasizes the communal, the public, rather than the private sphere. So for many Greek immigrants, especially the elderly, their identity is closely tied to their behavior within that communal and public spheres in the community. So that sort of value is stemming from this understanding of the individual revolve in the ways in which a person behaves and presents to others. And we know that family relationships are very important to Greek population. The family has a strong role in decision-making regarding the care of older people. There has been a tendency to have a patriarchal social structure, particularly if we're thinking about Michael as the father. There's a consideration of them as being somewhat of a protector, a provider, a bit of an authority in the family, and Greek mothers are expected to take care of their children and honour their husband. So we know things are changing, but traditionally children and family members care for the elderly or older people at home where possible. And so that is another consideration of thinking about with family. being able to have an active role, even though Michael and Sula might be moving into aged care, where is the role that the family can play to be involved? So attitudes to death and dying, important for us to also consider this. For most Greeks, the beliefs, rituals, and traditions surrounding death and mourning are founded very much in that Greek Orthodox religion. For many, following the traditions practiced in their homeland is really important. Family members and loved ones often consult their local priests and other relatives to ensure these traditions are followed appropriately. And for many Greek migrants who arrived in Australia as children, knowledge of the traditions may come from early memories of funerals and memorials in their village and town. They might also remember vigils in family homes where, women would wail for what's called funeral dirges over the body of the deceased. Although that ritual's not followed a lot by Greek Australians today, many traditional beliefs and customs still remain important. So it's important to understand where these things play an importance for Michael and Sula. And just finally on these points, the notion of eternal life of the soul and the integrity of the body underpins many of the traditions surrounding death and mourning for Greek people. So, for example, cremation might be forbidden as it represents a destruction of the physical body, if you like. Although that, again, that is something that is changing. So I think just understanding some of these sort of aspects of, attitudes to death and dying, do we, for example, is it appropriate that we tell Sula that her case is going to be an end of life situation? How do we deal with that in terms of the concerns for Michael's emotional well-being at the loss of his partner? Every family is different and every person is different, but what we really want to do is understand their needs and make sure that this is in fact individualized. So I guess meeting palliative care needs in this time of transition includes a recognition of spiritual care for both of them. Their spiritual care needs are distinctly personal and it is a human right. And that is also nuanced in the new Aged Care Act about religion and spirituality. It identifies how an older person would like the end stage of their life to be supported. And spiritual care needs can be expressed in a number of ways. Dr. Irene, I don't know if you would like to read out or call out a few of those.
Oh, I'd love to. I'd love to. Thanks. Thank you very much, Rachel. We know that for Michael and Sula, family is absolutely central in their life experience. We'll all be familiar. If you're not, I suggest that you download the Aged Care Quality and Safety Commission's information about partnering in care, where family members or other people with the consent of perhaps Michael and Sula are taught how to help care and encouraged and supported by the staff in the service to do that. Food preferences are important. Menu choices that are particularly, it's a Greek nursing home, so I'm very confident that the menu would be firstly, would have been translated into Greek rather, and that the food preferences would be very heavily weighted toward the things that would be familiar to older Greek people. Support for beliefs would certainly be active. I'm sure there would be weekly services or probably services each day, prayers of some sort. There's one Greek nursing home that I've had quite a lot to do with, where every morning the Orthodox priest comes in and all the televisions can be tuned to that Greek Orthodox home's own channel. and prayers and mass are said. It's important to provide some quiet space for people. Anybody who's been in a residential aged care home, you really do know how noisy it becomes. It's the excitement of life, it's everything that happens in the day, it's food trolleys, it's other sorts of trolleys, it's people bustling around. Prayer and meditation, they do require a quiet space. Most faith-based residential aged care services do have a chapel of some sort or a quiet space where services are held. It's important that that space is preserved so people can go there whenever they like, just to sit quietly. Reading sacred texts, it might be a Bible, it might be a particular author that writes about spirituality, could be a prayer book, could be saying the rosary, it could be a number of things, but anything that has a sacred text context should be encouraged. And you should ask when you're doing the assessment if it applies in their case. Items of spiritual significance are important, particularly for Michael and Sula. They have icons in their home, so it would be very natural for them to want icons within their new living space. Sometimes during fasting leading up to Orthodox Easter, special attire is worn, and other items of significance like prayer beads become important. For Michael and Sula, a part of their spiritual journey is to have ongoing e-platform family connections with their family overseas. Very important, it's their lifeblood. Playlists of significant music can be compiled by family members who know what they enjoyed. They tell you what they enjoyed, and your wellbeing staff might actually put the playlist together for them. Receiving the sacrament or communion is really important to Michael and Sula, and because of their choice to go into a faith-based home, that would be facilitated on a very regular basis. Spiritual rituals that might be specific not only to a Greek Orthodox situation but to other denominational situations should be interrogated and included into the care and service plan so that they don't miss out on the things that give them meaning. Appreciation of nature, sitting out in the garden, for example, being able to just, something as simple as opening the window and smelling the cut grass. All these things are triggers to their former life, which are important. People and community connectedness. We know that the new standards really do emphasise how important it is, regardless for the aged care setting, that people are kept in contact with their previous community, if that is their choice. So they don't feel like, hey, I'm in a nursing home now, what's going to become of me? But there's active encouragement to take people back to their communities, to go and have coffee with friends, have a facility where friends can be invited in their sitting room. They can have, tea and coffee provided. Very, very important, particularly as Rachel's pointed out, that the community is really important to older Greek people particularly. Access to Greek Orthodox spiritual practitioners, very important. And because of where they're situated, there will be a priest as part of the staffing profile. There's many more aspects to spirituality, but for Michael and Sula, these are very, very important aspects that should be assessed in a spiritual assessment and transferred to a spiritual care plan for development, delivery and evaluation.
I'll just add to this slide, if I might, that another good place to think about or give you ideas of what kind of spiritual care needs might be relevant for Michael and Sula is to have a look at the national guidelines for spiritual care and aged care, because that's a real roadmap to enabling spiritual expression. And in particular, I think the outcomes and actions that you know, are a domain within that guideline, and that really does give you those sort of those cues. So you know, looking at individual and group activities that promote spiritual growth, because Sula is getting, you know, is going to be in that end of life phase or palliative care, doesn't mean that those things necessarily need to stop, but it might be different for Michael. You know, things like spiritual reminiscence groups, life history and life review could be really important at this time. Older people have access to the natural environment, as Dr. Irene mentioned, connecting with loved ones, and again, thinking about Sula, it may be that when she has time connecting with family, it might be that she wants to reach out and make amends at this time of palliative care. She might need to have that time, as Irene said, where she has time online with her brother, for example, that's just to them and there's no one else around, so that there's a privacy around having conversations that, you know, may not have taken place before, but because of that end of life period, it's something that's quite sacred and private. You know, older people are supported to participate in creative aspects, you know, being able to paint, draw, poetry, storytelling, this kind of thing. And also the organisation facilitates having access to those, you know, those sacred texts and discussion groups that promote spiritual growth and resilience. Loss and grief is dealt with, and that also other residents and clients that may also interact with Michael and Sula, you know, if they're impacted by Sula, because often when people do go into residential aged care and they make friends with others who are also living in residential aged care, and someone does pass away, there is a great effect to them, to those other people who are living there. And so being able to deal with that kind of loss and grief of someone who's passed away, so that the life of someone is celebrated as well. So, you know, commemoration services, books and photos are there also for others.
Thanks, Rachel. I might hand this one over to you.
Sure. So assessments, spiritual assessments are really important. And to make sure that we meet both Michael and Sula's needs effectively, we've got an example of one here, which is called Connect 2, which does make sure that we're addressing a number of those domains, particularly in reference to Pulcheski's quote about what spirituality is. But I'll just step back slightly and just explain a couple of elements about assessment. So there are sort of three components to a spiritual care assessment. And I'll just explain those so that you're aware, for those who may not be. So you've got a screening, a history, and an assessment. Spiritual screening is kind of a triage example, a quick determination of whether a person's experiencing, for example, a spiritual distress or crisis, and therefore needs an immediate kind of referral to either a spiritual care practitioner, if that is available, a chaplain, a faith leader, or another healthcare practitioner. And good models of spiritual screening use a few kind of questions that can be asked in the course of that overall patient and family screening when someone new comes into care. So examples of that sort of question would be, what gives you strength or your sources of strength when times are difficult? So that's kind of something simple that can happen at a very kind of superficial or early level. But then there's also spiritual history taking, which is the process of interviewing somebody in order to come to a better understanding of their spiritual needs and resources. So compared to screening, a history is a more, or it's taking a broader set of questions to capture information about needs, hopes, and resources. And then you've got a spiritual assessment. And that is a more extensive process. This requires active listening to a person's story. And it's usually taken by someone who's got some training to do that, such as a professional spiritual care practitioner, so that it summarizes the needs and resources that emerge through that process. There is a number of different tools, as I mentioned, to collect and document this information. These types of tools, there could be FICA, which is Faith Believes Importance Community. There's Spirit, which is Spiritual Belief System, Personal Spirituality, Integration, Rituals, Implication, and Terminal Events. And there's another one called HOPE, which is Hope, Organised Religion, Personal Spirituality, Effects of Care, and Decisions. But all of those we'll be looking at, that more extensive process of active listening. We also have an Australian validated assessment tool, which is this Connect To tool, and it hones into those sources of connection for a person. It encompasses those aspects of nature, of self, the inner world, creativity, something bigger, and in this case, it could be faith as well as others, and as well as connection to community and others. So it's based on that principle that connectedness is an important aspect of spirituality, and the relationships between others. And those 5 domains being integral to spirituality itself. So the tools underpinned by that belief that spirituality is an important element for an older person's life. It can be done in a palliative care sense. It can also be done when someone's new, that you've met them for the first time delivering care. But it does open up the understanding of the core of their being, and provides information about what creates a sense of purpose and meaning. It's premised on the nature that the development of spirituality will lead to a better quality of life and inner peace. So I think definitely if your health service does not have a validated assessment tool, please do look for those, whether it's Connect To or one of the others. Lots of good information that we can share about maintaining these practices for spiritual safety. Dr. Irene, would you like to list through some of those?
Certainly. I'll begin by saying, Rachel, that all the 7 standards underpin spiritual safety. In particular, standard 1, where we look at diversity, and we look at spiritual and cultural safety, is really important. So how do we maintain these practices for spiritual safety? We plan and provide spiritually and culturally safe care and services that firstly acknowledge and document the importance and value of people's beliefs. And as Rachel has just said, spirituality supports well-being and quality of life. And if we go back to that very powerful I statement at the beginning of this webinar, it was, I want to live the life I want to live and how I want to live it. That's the inherent message in that very powerful statement. Provide support for people, older people, to continue their established spiritual practices. And we've demonstrated this in this case study, where the environment is able to be created to support the orthodox beliefs of the couple. Align spiritual practitioner support. By election, they've gone into a Greek Orthodox faith-based home. So they've put themselves into an environment where they feel that they will be spiritually and culturally safe. Partnering in care, which I spoke about just a few minutes ago, very important concept. where education and support is given to family members to actually be able to provide some of the care that this couple will need as they continue their journey in residential care. Wherever possible, arrange attendance at their church. Take them back to their church. You can do that through family connections, community transport. There are a number of options that you can use in order to keep those very close community connectedness in place. Live stream services. In this particular home that I've done some work with, that happens every morning. They've got their own church channel, which they use, and it's really lovely. You hear the chanting as you're walking through the corridors, and it's amazing. Even the most agitated people are quiet and they are still. It has a profound effect, that huge impact. Establish a family altar in their suite using icons and other worship supports from their family home. It's not uncommon to go into an older Greek person's home and they have a small family altar there, you know, with family photos, some candles, and some incense perhaps. Very important, and there's no reason. Perhaps the candles might be a problem if it sets off the fire alarms, the smoke alarms, but there are electronic workarounds that you can consider using in that context. Let them put icons on their walls. How simple is that? A constant reminder of their spiritual journey and their spirituality. Provide appropriate playlist background music if requested, just within their own space. And very importantly, and I can't emphasise it enough in the context of this palliative care presentation, respect end-of-life wishes. And we know that when we talk to people about end of life and how that would like to play out for them, that it's not a single conversation. We know that it's a series of conversations. It may never, ever get to a conclusion, but it's important that it's addressed. And we know that particularly for some of the early migrants to Australia, it's very difficult for them to talk about end of life. And yet it's so much part of their own spiritual journeys. It's so important to, as Rachel has said, actively listen, pick up the cues from the conversations and embed that into the care and services that you do provide. Again, this all cuts through standards 1 to 7 in the new world. But there are some sorry, Rachel, go.
Oh, I was just going to say, I do love also when you mentioned the idea of, you know, the Greek coffee culture, and I certainly know that, you know, in the case of Michael, it might be really important to help him connect with, you know, making sure that he can possibly do that and continue that so that he has another level of support as you know, Sula's needs become more and more increased, and he might need some respite from that, you know, considering the fact that you know, we have two different people now on slightly different trajectories in that sense of palliative care. And yeah, in Sula's case, being able to have some of those private conversations, recognizing that in a way, you know, some might say that, you know, that person is now approaching the altar. I've heard that term, that someone's kind of spiritual life often doesn't follow the same trajectory as perhaps their own clinical indication of what's going to happen in the ensuing period of time. Sula's spiritual needs may actually be much greater and be accelerating at this point. So recognizing that to make sure that we are meeting those needs. Thank you, Irene.
Thanks for that, Rachel. We're going to look at some considerations now going forward. And we always must remember that the focus is on the older person at all stages through their journey. Sometimes people, their journey goes forward, and then that journey goes back a bit. Then it goes forward a bit, then it regresses a little. It's really important for the older person that you demonstrate that you understand that it's not just a linear plane that people are going to operate on in a spiritual realm. Plan as much as possible for the future, and as I just said, it includes really difficult conversations, what to expect and what to anticipate. It can be an uncomfortable conversation also, because perhaps the people that you're speaking to don't want to listen. They don't want to hear that they're probably entering, yet another final stage of their life. It's important in the spiritual care plans to support ongoing or renewed dedication to faith and preference for spiritual care. There's a lot of evidence to suggest that as people are nearing the end of their lives, there is a renewed dedication to faith, and they do value spiritual care very much. They may not have been a church attender for many years. They mightn't have been since they went to Sunday school. They may have had very little organised church contact, but as they are nearing the end of their life, there is a renewed approach to wanting to reconnect to those things from the past. It's important as workers that we recognise our own personal spirituality, that we're very comfortable in our own skin about it, but that we don't impose it onto other people. It's very, very important. You may not share the same belief system as another person, but we don't impose what we believe to be our spiritual journey on somebody else. It can cause deep hurt and deep distress. In the diversity frameworks of your organisations, when you take a really close look at them, you'll see that we have to accept everybody at the point they are at that point of time. So we cannot impose other belief or spiritual structures on older people. Put the pieces together. Not every conversation will have a complete outcome. We might take 2 steps forward at this particular point in time, and then the person's gone away and thought about it and thought, oh, I didn't mean to say that. And so you have another conversation and you've gone back a step. But document the journey. It's a very important journey, and the families and the friends and the people that love these people will really, really appreciate you being able to share that journey with them. Acknowledge people have different ways of acknowledging what is happening. And by that we mean people have different ways of being, I guess, in the present, being right now. And we may not share the same reality as that person. If we think about people living with cognitive decline, for example, across a range of pathologies, quite often their reality is not our reality. What we have to do is support those people to live in that reality. And doing that in a spiritual context is very important. Consider how you can connect with people in face-to-face methodologies and virtually. And this is really important, particularly as Sula is on probably a deteriorating trajectory, that she continues to have, FaceTime or Zoom or Googlies, whatever, with her overseas family. Try See Me, Know Me or Reconnect cards, stimulating questions to share with family about their life and who they are. As Rachel has said, there are a number of spiritual assessment tools that will give you some good guidelines about how to, I guess, capture the history of that person so that you've got it and you can share it with the family when the time is right. And finally, another consideration is allowing an ability to take time to reconcile with faith, recognising that people will want to perhaps revisit their form of positions about faith, and to reconcile with family. Families fracture, friendships fracture, and other relationships that are not necessarily family or friends fracture. And it's really important that in the broader definition of reconciliation, older people on a palliative pathway do have an opportunity to put things right with people. It brings them a great deal of spiritual solace and spiritual connectedness. And it's a very important thing for them to be able to do if that is their choice.
Thank you, Dr. Irene. I do want to certainly say personally, I've seen that happen where there's a limitation to sometimes things that we can do in palliative care, but being able to allow people to, do that reconciliation and has an incredible effect on someone that just gives them a sense of relief and peace. And I just quickly want to, in the short time left, I know we've got some great resources and one last slide, but I also want to just draw back to the research and some of the, the research that's demonstrates the importance of all of this. Research definitely says that spirituality contributes to quality of life and well-being. It's been associated with positive emotional mental health and the ability to cope at a time of stress. For many people, spirituality is important throughout their life. For many older people, spiritual care is especially important at end of life. Spiritual care is an important aspect of palliative care, holistic or inclusive care, dignity conserving care, respectful and culturally appropriate care, and compassionate care. Another research says spiritual care is also important for the person who is dying, as well as family members and care providers. And the national guidelines for spiritual and aged care are available to guide care. Spiritual care can be provided by all members of an aged care or palliative care team, and it's optimized if a whole organisation approach is taken. And finally, spirituality and religion appear to have a positive effect on older adults with dementia, which, really refers back to that point that you made earlier. So those statements that I've just read out there are all demonstrated and proven through research about the benefits and why it's so important.
Thanks, Rachel. Our final couple of slides are just to provide you with some useful resources, and they're hyperlinked. When you get the slide deck, you'll be able to have direct access to them. Strong recommendation from us both is that you take some time to actually have a look at some of these resources. Without doubt, the Aged Care Quality and Safety Commission has had a really sharp lens on spiritual care and planning, and I can't see that going anywhere, going away on any level. I think it will, as diversity is a thread through the strengthened aged care standards, and we know that part of diversity is the recognition of spirituality and spiritual difference, that we would commend these resources to you. So on behalf of Rachel and myself, we'd like to thank you for attending this webinar. We do enjoy it so much, don't we, Rachel?
We do. Thank you so much for watching.
Yes. Take care and stay safe.
Bye for now.
Bye for now.